And thank you again for those of you joining. We'll stop sharing our screen in a few moments, and so hopefully you'll be able to see us a little bit bigger, for better or for worse.
We might be wearing sweatpants too, you won't know.
Yeah, that's the mystery. No one knows. Great. Again, those of you that are joining, welcome, and we do not see you, so you do you while you watch us. Hopefully you are taking a lunch break. We had encouraged people to use this as an opportunity to take a lunch break. This is really your time, and we hope you get something out of it. All right, I think we're gonna start now. Stop sharing. Hopefully I did that right. Welcome everyone, thank you so much for joining us. I'm here with Dr. Carly Bosacker and Dr. Rivka Halpert. I am Dr. Jessica Weiss. I think my thing doesn't say doctor, but that's all good. Take care. So it's a phrase that we often say to one another, kind of casually, like it's sort of like see you around, take care. And I found that as a psychologist through the years, it's kind of the thing I say to my patients when they're leaving the therapy room. I say take care. And just so you know, when your therapist says something to you, it's never casual. It always means something. And so when I say take care to my patients, what I mean is like truly take care of yourself. Take the skills and the tools that we've been talking about today and really use them to take care of your mental health, whatever it is that you're working on. And I found that in the past few months, people have really been saying that to one another as well, take care. And what it means in this context is, first of all, take care of your physical health. Do whatever is in your power right now to not get sick, but also take care of your mental health. And I think that one of the silver linings of this pandemic, and there are, of course, many silver linings, which maybe we'll talk about today, but one of them is that mental health is finally getting kind of the attention that it deserves. People are really talking about, how are you doing? They're asking each other that, they're frankly discussing this. You can't open a paper or open CNN, New York Times, whatever your news source is, without reading an article about mental health and how people are navigating this really tough terrain. And so we wanted to offer this webinar to all of you to really help you to take care. And when we talk about best practices, we say best practices in taking care of yourself right now. Best practices is really, what is the research telling us? How can we best take care of ourselves? And when we look at the research as it relates to psychology and mental health, decades and decades of research have shown that the best way really to take care of yourself and to improve your mood, decrease stress, overall mental health is what we call cognitive behavioral therapy. Cognitive behavioral therapy, or CBT, we might call it CBT today for the next hour. It is a symptom-focused, goal-oriented therapy that really focuses on the here and now. So unlike some traditional therapies, I don't know, some of you might have watched Sopranos and Dr. Melfi. She was sort of like a more traditional psychodynamic, psychoanalytic therapy. Cognitive behavioral therapy really isn't like that so much. We do not focus as much on the past, although we certainly do consider what you might have experienced in the past, but really it is about the present and how can you make specific behavioral and cognitive, meaning thinking, which we'll talk about in a few minutes, how can you make those changes today? And that is the type of therapy that we practice at Grand Central Psychology. So a little bit about Grand Central Psychology. I'm one of the founders and clinical directors, along with my partner, Dr. Debbie Neft, who I think is on this call. She's not presenting today, but I think she's watching at home. And we started this practice and we named it Grand Central Psychology. We thought it was the best name because our office is right across the street from Grand Central Station and it's beautiful. And if you go to our website, you can see the ceiling of Grand Central Psychology. And of course, right now, it is the worst misnomer because none of us are practicing across the street from Grand Central Psychology, of course. We are all at home or at other people's homes. You don't know really where we are, but we're not across from Grand Central Psychology. But we're doing teletherapy. And if any of you have questions about teletherapy, we'd be happy to do that. And so joining us today from their own homes and their own couches, as I mentioned, Dr. Carly Bosacker and Dr. Rivka Halpert, here to share their expertise with us. These women have worked really hard for their titles. However, I'm going to scrap that for the rest of today, call them Carly and Rivka, because we're pretty casual. And we really want this to be sort of a conversation, but also to include all of you. So if at any time you have a question, please just chat it. I'll be in charge of the questions. You can also use the Q&A feature. Probably chatting is easier. So there will be a section for Q&A later on. But throughout, if Carly or Rivka is explaining a concept that you have more questions about, please feel free to just chat that to me and then I'll convey that to them. So Carly and Rivka, you guys are really at the front lines of mental health, of what's going on in our country when it comes to mental health. You really have your finger on that pulse. So I guess I'm going to start off right now just asking you, oh, before I do that, let me give a little, I'll ask you in a second, but I didn't give a little intro about who you guys are. Everyone's probably watching, wondering who they are. So let me do a really quick intro. So Carly, she got her doctorate at the Philadelphia College of Osteopathic Medicine. She has previously had jobs, research and clinical work at Yale University, the Child Mind Institute, and Mercy First. Most recently, she was the director of therapeutic services at Therapy West. She has extensive training in OCD and PTSD, and at Grand Central Psychology, she sees adults, tweens, and teens. I like to think of her as our resident teen whisperer. I don't know how she does it, but she somehow, she knows how to talk to these teens. So that's Carly. And Rivka got her doctorate from Long Island University post. She has previously worked at New Jersey VA Medical Center and the Stress and Anxiety Services of New Jersey. And in addition to her private practice work at Grand Central Psychology, she is also a psychologist at an inpatient unit at Columbia Presbyterian. She specialized training in OCD spectrum disorders, and PTSD. Working with an adult population, she combines cognitive behavioral therapy with more mindfulness-based approaches such as acceptance and commitment therapy, or ACT, and dialectical behavior therapy, or DBT. And I like to consider Rivka our resident mindfulness maven. So with that, what are you guys seeing? What are you seeing right now when it comes to people's mental health?
Yeah, I'll jump in on that. Big theme of uncertainty. You know, our medical professionals are a little uncertain. Our governors are a little uncertain, and no one is really giving us a clear direction on where things are headed. I mean, there's been some helpful, parameters here and there, but I think everyone is just sitting here thinking, when are things going to go back to normal? Is that even a thing anymore? How do I handle that? What can I control? What can't? And that's just been a big, something that's been coming up, I think, with everyone across the board.
And so how do you help people with that?
Yeah, and everyone hates when I tell them how you deal with it, because it really is learning how to kind of sit with and tolerate the uncertainty and sort of teasing apart what are some things I can control and how can I problem solve around that, and what are things that I just have to sit and accept, hey, I have no control where this is going right now, and I have to figure out ways to manage my own stress within that.
Yeah. I think I saw someone's hand raised. Hold on, let's see. I feel like a teacher in my kid's school. I saw someone's hand raised. Okay, if you have a question, actually chat me instead of raising your hand. Just chat it. It'll be a little bit easier. But thank you, Carly, for that. And Rivka, what about you? What do you see?
Yeah. I'll definitely second what Carly said. I think a ton of uncertainty. I think also with, working with a lot of folks with OCD who have an extra difficulty tolerating uncertainty. In many cases, that's been magnified by the pandemic, especially if the OCD is related to contamination or health concerns. Something I've been seeing more recently is actually uncertainty specifically related to the reopening, and this kind of new, it's like a combination of excitement and relief, but also heightened anxiety about what what are these new phases going to bring? It's like we're all experimenting here. And also with that, a lot of tension between different family members, friends, regarding like the different approaches of how to handle social distancing, how to handle quarantining right now. So uncertainty, and also just a lot of relational tension, a lot of anxiety, and some disruption around that.
Yeah, I've definitely been hearing that. And so Rivka, if
Yeah.
a lot of my patients have been saying, like, I want to do this, and maybe some people are a little bit more conservative, not necessarily too conservative, but somewhat conservative when it comes to social distancing. But then my friends or family members are on the different end of that spectrum. So let's say, what would you suggest to a patient? Let's say it's you, and I say to you, Rivka, just come over to my house. Forget this, standing outside. Come over. We'll share some guac and chips.
Yeah.
What would you suggest?
We all had it already anyway. Yeah.
What's that?
I said, like, we all had Corona already.
Right.
Anyway.
Oh, yeah, people can rationalize it in any way. So what would you suggest to someone that's in that position? How do they deal with that?
Yeah. So I think, in that specific example, where, I'll zoom out for a second and I'll just talk like in generalities when somebody, if I have a client who's confronted with a situation like that, where their anxiety or cautiousness doesn't match with the other person's, I'll first just try to get more information, to try to gather the facts. Like, does their feeling fit the facts? Is it something that a lot of other people are feeling? I think with my patients, a lot of it comes down to, if it's an OCD patient, is this an expression of OCD, or is this kind of standard cautiousness? If it's more OCD, and if the patient agrees that it's more OCD, then I might, encourage and collaborate with the patient on how to face their fears and go out of their comfort zone. I think if it's, something, if the facts, kind of match their feelings, like the CDC is, still recommending XYZ, still social distancing, still wear masks, don't share food, then, we might work on like assertiveness skills. What
does that look like?
Well, a lot of people are reluctant to be assertive. They might think it's the same as aggressive. They might think it means like demanding what I want, sticking rigidly to it, not taking no for an answer. That's aggressiveness, but assertiveness is quite different. Assertiveness is, in an objective way, stating the facts of the situation. So, you invited me over. I want to see you. That's not a fact. That's more just like a belief. But, we're living in a pandemic. The CDC says XYZ. And then stating how you feel without using like accusatory language, more using what we call I statements. Mm-hmm. I'm very wary of going to your house, sharing food, not wearing masks when the governing bodies are still recommending that we don't do that. So I think I'm going to have to say no this time. So it's a combination of stating the facts, but then also very directly and clearly stating what you want, which is no, I do not want to come over.
Right. And for people that are viewing, the great thing about I statements is you're kind of taking ownership of it instead of labeling the other person's behavior. And so no one can really fight you on how you feel. I feel uncomfortable with this. That's it.
Right. Yeah, exactly. And I think it definitely takes practice. Role plays can help, role plays can really help rehearsing what you're going to say, depending on, how pushy the other person might be. But sometimes really just talking it out and being very direct rather than aggressive or passive aggressive or just silent, can be really effective.
Great. Yeah. One of the things that we talk about with our patients a lot, because we do practice, again, cognitive behavioral therapy, the cognitive piece is how is our thinking affecting how we're feeling and how we're acting. And I think in this situation, there's a lot of cognitive stuff going on. So I'm just wondering from you guys, for lack of better words, what cognitive distortions do you see playing out when it comes to trying to navigate this new normal of social distancing, but also reopening?
Yeah, absolutely. I mean, I'm seeing a lot of catastrophizing, jumping to the worst case scenario and just letting that completely overwhelm your thought process. I should be doing this, I shouldn't be doing that. There's this funny saying, don't should all over yourself. And
should, people should.
Don't should all over yourself. And that really backs you into a corner, because then every move you make almost becomes this black and white, all or nothing. Oh my goodness, I didn't do that. That means I'm a failure. I'm a bad parent, or you want to try and lean more into being as flexible as you can, and maybe having a couple, maybe you always have dinner together as a family and that's your anchor of the day, but allowing yourself to kind of roll with the punches also, because you're only human.
Yeah, I found that especially, there's been very different phases of this pandemic, and especially in the beginning when people were really hunkering down, there were a lot of shoulds, a lot of like, okay, now's the time. I can finally clean out all my closets, and I should take advantage of this time and finally learn that language I've been wanting to use, and I can finally get my kid to up their game with their academics. And so that's a really good point. And now, as we've shifted into this different phase, there still are those shoulds. Yeah.
Oh, definitely.
Rivka, any cognitive distortions you're a big fan of right now?
Yeah, well, I think that to go back to what you said about what was going on at the beginning of the pandemic, I mean, I still think it's going on, but what I was hearing a lot at the beginning was, I should be doing better, like you said, Carly, but especially, people comparing themselves to others and just feeling like they're the only ones not managing well. And again, even now it's coming up, and, this idea of I am feeling really stressed out and I'm anxious all the time, and that's a bad thing for some reason, even though there's like a global pandemic going on and we have no idea what's going to be next. People just somehow still expect themselves to behave in this completely poised way, when really that's kind of impossible. There are going to be times when you're just going to feel anxious. You're not going to be as productive. And so I think highlighting those and, again, like helping the client take into account the context and the facts.
Mm-hmm.
Like, how many kids do you have at home? How many kids are you trying to homeschool right now? Oh, and you have a full-time job? Like, just like reminding people, like literally what the facts are, not sugarcoating anything. Like, trying to challenge cognitive distortions is not sugarcoating. We're not saying, oh, it'll be fine. You're doing perfectly. We're really just trying to get the facts straight. And a lot of times when we're in that very anxious, catastrophizing mode, we're totally disregarding the facts. And we're not looking at how well we're actually doing.
Yeah. And so I think part of our job as therapists, and part of what people even at home could do for themselves, is to help them to look at the facts, look at how can we look at this rationally based on the true evidence that's before us, not just the cognitive distortions that might be at play.
Mm-hmm. Yeah. I also, I think that one thing that people often say about CBT is, a lot of times clients will tell me, well, like my negative thoughts are true. Like they are accurate. They are logical. And yeah, like, of course, especially during a time like this, a lot of your negative thoughts are going to be accurate. But then the question is it helpful? And, if dwelling on this thought, if I can't do anything about, XYZ reality, if I can't problem solve, then maybe I want to still reframe the situation, not in a way that's not true, but in a way that's just a little bit more balanced and positive. I also think, being compassionate with yourself in a very specific, concrete way is really important. I think self-compassion literature in the last decade or so has really exploded. And for people watching this, you can look up Kristen Neff, selfcompassion.org. There are a lot of self-compassion researchers out there, and they're putting out great stuff. And I think that there are quite a few, when people hear the word self-compassion and being nice to yourself, they often view that concept as being self-indulgent, letting myself off the hook. They view self-compassion as an obstacle to self-improvement. So if I'm thinking I'm not doing well, how is being nice to myself going to help me do better? And, you know, I don't think I could do justice to the concept. I really love self-compassion, but, you know, just in a few words, I think that self-compassion is this, it's this idea of unconditional regard for yourself.
Mm-hmm.
And part of that is, you know, just to be specific, what's one way we can do that is to remind yourself that other people feel inadequate also, and other people feel like they're failing also. It's this idea that's called common humanity. And just reminding yourself of that can help.
Especially now.
Especially now.
Yeah.
Especially now, there's such a sense of, I mean, there's a reality of isolation, and then there's a subjective sense of isolation where, like, I'm all alone in my suffering and I'm not doing as well as other people. But one final thing I'll just say about self-compassion is that it actually promotes self-improvement, because if you think about it, if you love yourself, you can view yourself more fully and wholly, and so you don't shy away from imperfections or failures. And so if you're able to notice those flaws, you're obviously more likely to improve them. Usually if we're self-critical, we can't face those flaws because we know we're going to hate ourselves for it. And so just, you know, just to plant a seed, you know, for people who are feeling like, I'm not doing well enough and there's no way I could be nice to myself. Like, look how much I'm failing. No, it's the opposite.
Yeah. I love the concept of talk to yourself like you would a really good friend.
Yeah.
Because the things we say to ourselves sometimes, and especially today, we would never, ever say to a good friend. So that's an exercise I often go over with patients, is like, what if a friend was going through exactly this? What would you say to them? So that's like a really easy tool for those of you watching of how you can shift your mindset. Because when it's just about you, it's really hard to think differently. When you shift that to, what would I say it to a friend? Or what would I say to a friend? It's much easier to have that self-compassion. Right. Carly, I want to go back to, you had mentioned catastrophizing, which is essentially making mountains out of molehills, right? We take like something that's perhaps negative, but we make it into this like really awful, awful scenario. I've got to admit, when I'm reading the paper these days, when I go online and I see what's going on, and I'm sure most people that are watching this would agree with me, I catastrophize. I go into that because it's scary stuff. So how do you suggest to people that they don't catastrophize at a time when really there is so much uncertainty, to your point earlier?
Yeah. And it's just like you were saying, it's so hard not to. And, you know, you can do something similar to what Rivka was saying, test the facts, but then you're reading the facts, or someone's telling you this is a fact and you're like, oh, what do I believe?
Or is it fake news? Yeah.
And to tell, you know, everyone, just don't look at it. Don't worry about it. That's just not realistic. But I think that you can really limit the amount that you're taking in, and maybe just pick 2 reliable sources that are your go-tos that you're like, okay, this is usually, it's not this dramatic fear-mongering message where I just feel so anxious. It's factual, and then I can kind of set it aside. And also paying attention to, if you take in the news the first thing in the morning, if that sets you up for just kind of a really terrible day, then maybe push to check in at the end of the day. And just be mindful of maybe what's happening to your thoughts and feelings after you're reading a certain message.
Sure. I know a lot of my patients, and frankly, a lot of my friends and family members, they get these push notifications on their phones that anytime anything happens, they find out right away. And I've really recommended to a lot of people to just stop that, like really just get rid of those push notifications. This way you can control your consumption of the news. So in CBT, there's something called stimulus control, and it's exactly this. Like the stimulus in this case is the news, and you need to be in control of how much you're taking in, because it can feel really overwhelming. And I promise you, those of you that are thinking like, yeah, but I want to be well informed, you're not going to miss anything if you control that.
Absolutely. And just another plug for parents, or even if you're living with other people. 1 second, there was a siren going by. Of course.
We can still hear you. We're used to it.
Let it be nice background noise. Just be mindful of modeling your own behavior and tolerance of news and uncertainty, because kids especially they're like sponges, and they're watching how you handle stress and what you say. So just be mindful of, even if you're feeling anxious, to maybe model, okay, you know what, I'm feeling anxious and it's okay. I'm going to take some deep breaths, and I'm going to set the news down for the rest of the day, and let's do something fun together.
Mm-hmm. Yeah. And I think especially parents who have tweens or teens that have these bad boys, be aware of what's coming through on their phones as well, right? Just because they might be getting inundated with those push notifications.
Yes.
Yeah.
Also, like good news sites, or like the good news sections of these things. Like, I've gone on those. Some of them are like super hokey, like sappy stories, but honestly, it can be so much better sometimes, and it's just like a break.
Yeah. I think all of the world has fallen in love with John Krasinski.
Yes.
Good news. Yeah, and there's nothing wrong with that. It's possible to both take in everything terrible that's happening right now and take in some good stuff. I love the concept of yes and. Like, yes, you can feel this and you can feel something else. They don't have to be mutually exclusive. Yeah,
absolutely. And I think it's a form of self-care. I think the word self-care has become such a buzzword. And it's not just like taking a bubble bath and like indulging in like a chocolate. Those things are great. But I think really tuning in with yourself and saying, what do I need to limit a little bit to take care of myself right now?
Mm-hmm. Absolutely. Great point. Rivka, when it comes to going back to the self-compassion, I think a big piece of self-compassion is meditation. Am I right? When I say that, you're the
mindfulness,
the expert, or mindfulness, exactly, mindfulness. Can you demonstrate some of that for us? Can you take us through maybe a mindfulness exercise that will help us? Because I think especially when we're feeling so out of control these days, it's really useful to have a tool that kind of brings us back. I know for myself, I've never been a big mindfulness person, to be honest, and the past few months I've really taken it on. So I'd love for your expertise to kind of take us through a mindfulness exercise, and what does that look like?
Yeah, oh, definitely. Before I do that, I'll say a few things about it for those of you who might have just heard the term, but who don't know that much about it. Mindfulness in general, I have so much to say about it, but I'll try to distill like the main points. Mindfulness.
We have a half hour left.
Yeah, right. So mindfulness is paying attention to the present moment. That's the basic definition. However, it's paying attention in a specific way. It's paying attention in a gentle, non-judgmental way to the present moment and without attachment to the present moment. So, for example, it's, kind of noticing negative feelings without either trying to push them away, or without like stewing in them, or without judging ourselves for them. It can also be, one of my clients described it as like a vacation from my own brain, which in a way, like it can be that sometimes, because the idea, not all, but a lot of distress comes not from actual hardship that's going on in the present moment. Of course, plenty of times, especially now, it does. But like moment to moment, like right now, probably if any of you are feeling tense or worrying right now, for most of you, there's probably nothing right now acutely going on that's distressing. It's most likely due to you worrying about the future or dwelling on the past. And so mindfulness anchors us in the present, and in that way kind of does get us out of our own head. And so what I'll do with you guys today is just a couple of minutes of mindfulness of the breath. The breath is usually a very good place to start because it's ever present. So it's a perfect way to be present. It's and usually we don't, have any complicated relationship with our breath, right? It's like a super neutral, ever present thing. And so you can follow my, verbal instructions. The two of you can follow along with me. I invite everyone to get into a comfortable position. If you're seated, sit in a straight, upright, awake posture that's not stiff, but that's still alert. And feet flat on the ground and hands resting on your lap, with palms facing the ceiling. We call this willing hands because this idea of, again, I'm kind of open to whatever the present moment brings rather than, the stance of like self-protection. And if you feel comfortable, go ahead and close your eyes. But if you feel afraid to do that, or if you're afraid you're going to fall asleep, then keep your eyes open, but resting on a neutral part of the room, like a blank wall or the floor. And gently bring your attention to your breath. Not trying to breathe a certain way. We're not trying to relax. We're not trying to do anything here. We're just noticing. Noticing how you're already breathing. And observing quietly to yourself how your breath already looks, moment to moment. Is it shallow or deep? Smooth or ragged? Is it through your nose or through your mouth? And anything else you notice. And again, there's no good way or less good way to breathe. It just is. We're just noticing. And every time your mind wanders to thoughts, worries, thoughts or feelings about this exercise, just notice that your mind went there and turn your attention back to the breath. Every single time. This might happen every moment. Mindfulness is not forcing yourself to stay present. Rather, it's returning your attention to the breath when your mind wanders. And when you're ready, you can gently bring your attention back to this room and open your eyes.
Wow, that was amazing. Thank you, Rivka.
Glad you enjoyed it. And for those, usually after an exercise, I'll ask people kind of what they notice about the practice. A lot of people share that their mind wanders a lot. Again, you have a normal mind if that's happening. And also, again, like there's not a goal with mindfulness. And so if you don't feel relaxed right now, that's okay, because mindfulness is not relaxation. Mindfulness is getting centered and just being present. Sometimes the present is distressing. So it's more of just a sense of groundedness rather than relaxation. Yeah. That makes sense.
Such a useful tool. I'm sure, like me, many people are thinking, how can I just call Rivka every time I feel stressed out? I just want to hear her voice. I know your schedule is pretty booked, so I don't think you can field all of our calls. So can you just suggest to us, what are some apps? What are some of your favorite apps?
Oh yeah,
that allow you to do this?
Headspace is great. I know I don't remember offhand which ones have free content right now because of COVID, but I know there are that do. So look them up. Look up Headspace. Look up Calm. There's also an app called 10% Happier. Those are the ones I could think of off the top of my head. Also YouTube.
Yeah,
so YouTube,
you can find everything on YouTube.
Yeah, search like 2-minute mindfulness.
Great.
Search 3-minute breathing space. I mean, they're super short exercises.
Great.
Don't think that, yeah.
And we just got a question from one of our from one of our participants. Are there certain times throughout the day you suggest practicing mindfulness? I'm sure it depends on the person, but when would this be most useful?
Yeah, it's a good question. It really does depend on the person. I would say if you're first starting to practice this though, practice it when you are not anxious or when you're not feeling any sort of intense emotion.
Okay. So then you can gather that tool for when you need it.
Exactly. So like overlearn it when you're feeling calm and able to kind of take it all in, so
Right.
that if there's a moment when you're feeling agitation come on, you can more readily use it. And again, like just going back to black and white thinking, especially people who are prone to anxiety can kind of impose their own like perfectionist tendencies on any sort of practice, including mindfulness practice. And the idea is like, even if you take one mindful breath a day, okay, so it's a start, just do that, be happy with that. It's okay.
Thank you. Now, Carly, working with kids and working with parents who have kids, I would imagine that what Rivka just did, it might be a little bit too much for kids, especially depending on their age. So what do you recommend in terms of mindfulness to help to kind of ground children?
Yeah, absolutely. I think one of the things is firstly debunking what mindfulness is. I think a lot of kids will be like, well, I'm not doing yoga, or I don't want to meditate.
Yeah.
No.
Oh, I think Carly is frozen. Oh, you're back. You're back.
Okay.
Go ahead. So you're debunking, and what else?
That it is practicing just being present in the moment.
Yeah.
So one of my favorite tools for that is to use your senses. So I'll say just name 3 things that you can see where you are, 3 things that you can hear, and 3 things that you can feel. So it could be your hands on the chair, it could be the sweatshirt that you're wearing. And the idea, again, is to just bring your mind back to, okay, I'm right here in the present moment. I don't need to let my thoughts wander so much to what I'm doing tomorrow or what I'm worried about, but what's going on right now.
Yeah. Great. Excellent.
Yeah.
Okay, so we've talked about a few tools today, some of the cognitive distortions and how you can talk back to them, and really using evidence that's before you, facts, things like news consumption and really limiting that, or at least controlling it. Speaking of control, things, recognizing what is and what isn't in your control, that old serenity prayer. And then, of course, mindfulness that we just did today. So I actually want to open it up right now to the participants for anyone that might have a question about any of the things that we talked about in the past 40 minutes, or anything else related to mental health and how to best take care of yourself. So if you have a question, please don't be shy. Please chat that to us, and one of us will answer that.
While we're waiting, can I actually add one thing?
Sure.
You're reminding me, so just going back to news consumption and, kind of filtering out that kind of those negative facts, is reminding me about gratitude and, how important it is to, again, sticking to the facts, just trying, even setting a reminder on your phone to try to think of like one good thing that happened, or going around the dinner table, or journaling it. There's actually a lot of research about gratitude journaling and the effect it has on mood.
It's not enough to, sorry, go ahead.
No, that's it.
I was just going to say, it's not enough to just be grateful. You have to act grateful. Mm-hmm. You have to take that mindful action towards gratitude.
Yeah.
Carly, anything when it comes to kids with gratitude?
Yeah, I was just going to say also, practicing gratitude together also as a family, making a habit of, every night everyone says 1 rose and 1 thorn. So one thing that was like meh today, and one thing that went well or you were grateful for. And sometimes
so the rose is the thing you're grateful for, the thorn is the thing that didn't go well. And I recently also heard, to add to that, a bud, like what is something you're looking forward to?
Oh, I like that.
Yeah. And sometimes listening to other people say what they're grateful for makes you be like, oh yeah, I forgot that I was grateful for that too. Or it just helps to remind yourself that, oh, there are some good things going on too.
Mm-hmm.
We just got a question. How can you differentiate between being smart and careful with COVID and your OCD acting up? It's a tough one.
So tough.
Because let's be honest, the behaviors that Americans and frankly most people in this world have been utilizing the past few months can feel and look a little bit like OCD. I mean, if we go back to April, how we were all dealing with our groceries, for example, before we were told not such a big deal, like
Yeah.
wiping things down and constantly, I mean, I saw the world as just a giant petri dish. And so it really is hard to differentiate what is just sort of normal response to COVID versus OCD. And then actually this person just added to it, my kids have been through so many, that's another question. So let's first take the OCD question.
I think I can start with this, Carly, if you want. I think, again, I guess it just goes back to, I try to, kind of guide my clients, to the like appropriate conclusion via like questions. And so I'll ask them like, what have you read about what the CDC says?
Mm-hmm.
Are you doing that, or are you doing more than that? What are, do you have friends who you trust that are careful? Okay, what are they doing? Are you doing more than that, or are you doing less than that? I mean, there are definitely exposures that I'm no longer doing. For 4 months, I have not told a patient that they cannot wash their hands. They have to wash their hands.
We're no longer doing exposure where we make them touch the subway
right.
and then lick their hands.
Right, exactly. Sorry, I should have provided context. Yes. And so, right. Not as a general rule, don't wash your hands. Only if you have contamination OCD. But now it's more just like, okay, the CDC says wash your hands for 20 seconds. So we're going to do it for 30 seconds instead of 5 minutes, So I think it just comes down to like knowledge of what the actual guidelines are and how much, beyond that your client is going over.
Sure.
Yeah.
And just to be clear, for those of you that don't know, the sort of gold standard for treating OCD is exposure with response prevention. So you have the patient expose themselves to the anxiety-provoking stimulus, and then the response prevention is that they can't do things like washing their hands. That's sort of like the simplest model of this. And just to be clear that even during this pandemic, I'm still, and I'm sure you guys are too, I'm still doing exposure exercises with my OCD patients.
Mm-hmm.
So, someone might have, I have a seltzer bottle right here, like a seltzer bottle that they think they are convinced because their OCD brain is telling them that is contaminated, that we will still do an exposure exercise. But yes, to your point, Rivka, there are some limits right now because we all have to be a little bit more careful.
Right.
Absolutely. And just to add to that, I think sort of recreating what the new normal is and what goes beyond that. So, okay, the new normal is we wash our hands when we come in from being outside. We might, sometimes take a shower and then we're okay. And if that's extending past that, then okay, this is your OCD brain acting up. Let's implement our strategies.
Yeah. Great. Another question that we just got, my kids have been going through so many disappointments. As a parent of children who were supposed to be in sleepaway camp, it's not just disappointment for them, disappointment for ourselves as well. But going back to kids, so many disappointments. What's the best way for me to help them through it? Carly, I guess this one's for you.
Yeah. I think just being as genuine and transparent as you can, say, yeah, this sucks. This really sucks. And figuring out maybe if there's a replacement activity that can still hold some value while acknowledging, yeah, it's not going to be as fun as camp, or it's not going to be as fun as what we were expecting, but let's try and brainstorm together how to make this not kind of be as terrible.
Yeah, and I think that a lot of us are going to be surprised that this might end up being a really fun summer, just because everyone has to be kind of spontaneous and make things work. I know a lot of my friends have been saying it's like we're back in the 80s, just biking around and the kids are free. So there's something that can maybe be gained from all of this disappointment, certainly some silver linings. And we're teaching our kids about resilience. This is hopefully the worst thing that they will experience in their lives, and they're going to learn a lot of lessons from this. Any other questions?
I don't know if you see, there are 2 in the Q&A section. Do you see that?
Oh, no. See, I don't know how to do this. Oh, great. Okay. How do you manage your own feelings of anxiety and stress about the pandemic when helping teenagers and adults best cope with their anxiety? So good.
Yeah, really good question.
I'll actually take this one. Something that I've kind of appreciated about the past few months is that, first of all, because we're doing teletherapy, people see my home. I mean, I usually try to have a blank background like this, but like they know I'm home, they know my kids are home, and there's been something kind of nice about having this shared experience with my patients. And so one thing that's been helpful is a little bit opening up with my patients about my own experience. I think Carly and Rivka, we've talked about this before, about how like for the first time our patients are truly asking us every week, like, how are you doing?
Yeah.
And so for me, to answer your question, it's really about taking a lot of the skills and the tools that I've been teaching patients for so many years now, and really internalizing it, and myself thinking about, okay, how can I shift my perspective here, for example? Or how can I start doing some mindfulness that I've for so long resisted? There's a certain vulnerability, even as therapists, that we need to take on right now. And so for me, that's been really helpful, is just thinking about like, what is it that I've been saying to my patients, and how can I myself employ some of those techniques? I don't know if anyone else wants to add to that.
Yeah, absolutely. I think another theme too for myself and others is this theme of setting up boundaries.
Yeah.
I think at first, initially, when everyone was on Zoom, it was like, oh, I want to have this Zoom party, and then my aunt wants to chat, and everyone knows that you're just at home and you have an excuse, but not really, and not beating yourself up for saying, you know what, I just need today to just not look at a computer screen, or I'm going to take the day and do something for me. I think that that's okay to do.
Yeah, absolutely. So someone just asked, do you think people will be more open to speak about their mental health with everything going on in the world?
I certainly hope so.
I do.
I certainly hope so. I think it's definitely a more discussed topic these days. And I think that, I guess one of the silver linings, if, is that this is discussed more, and mental health struggles are normalized a little bit more now. Everyone's talking about anxiety. Everyone's, and people, also people's hardships are maybe more public right now. I mean, people's losses, people are grieving. Those are things that people just naturally maybe know about more. So I think that, I certainly hope so. I think that, in addition, because telehealth is such a thing now, it might be easier for people to kind of get started initially. They don't have to leave their couches. They don't have to, kind of get into formal clothes. And therapists are in a way more accessible now.
Yeah, I think we probably would all agree. We miss in-person therapy for sure. I miss opening up my office. I miss seeing you guys. I miss seeing Debbie and having a place and commuting. But at the same time, teletherapy has really offered these new benefits of not having to commute and being able to sort of do therapy in the place where you live, which is huge. Going back to what I was saying before about doing exposure exercises with certain patients, like they have everything at home they need to do these exposures. So there certainly have been some benefits to teletherapy. I do hope one day we go back to in-person, but for right now, I think a lot of us are really appreciating some of those benefits. We have a question. How can you tell when you've been doing therapy for a little while and you aren't sure if it is enough or working, and you may need something more or a change? Great question.
Yeah, that is a really good question.
Yeah, I mean, I can jump in on this. I think first you should talk about it with your therapist and be very transparent. Say, hey, this is how I'm feeling. Should we tweak something? Should we set a new goal? This isn't working for me. Can we talk about what has worked, and what do you think? I think that's a good first step.
Mm-hmm. Yeah. I think also like concrete benchmarks, just certain ways you're functioning. Are you realizing that you're sleeping more? Are your friends making comments, about ways you've improved? Are you more interested in things that you used to love doing, but for a while just haven't been in the mood? So I think certain concrete things like that, noticing if those things have changed. A lot of therapists, one of the big things in CBT is data collection. And so in other words, marking certain points throughout the therapy to kind of assess progress, and doing that in a bit of a formal way, like even through a questionnaire, seeing if your scores change. That's just one very, very concrete way to do it. But yeah, Carly, I would definitely agree with you. First step, just talking to your therapist.
Yeah. And we just got a really interesting one. Just as it's difficult sometimes to differentiate between OCD behaviors and caution, how do you differentiate paranoia from appropriate caution in this political climate? Who wants to take that one?
Yeah. Paranoia and cautiousness in this political climate. I mean, I guess I would always, and it takes practice, and I hope this doesn't sound like a superficial answer, but again, like looking at the facts, which includes past history. So, you know, when I thought this before, when I felt this level of anxiety, what ended up happening? Were my fears founded? Were they not founded? Looking at, trying to assess the probability of things based on current facts, and also, you know, what has happened in your recent past. And again, like asking yourself, do people I trust feel the same way? Do people I trust who are in a very similar situation to me feel the same way? And I also, I'll just add, it's a weird time, and to just, maybe my thoughts might be distorted, and maybe I may be experiencing kind of paranoid thinking. However, to just validate the feeling, like you feel what you feel, maybe you don't want to act on it, maybe you don't want to dwell on those thoughts, but to just validate the feeling.
Yeah, and one of our participants just added to that, I also think that one might evaluate the degree to which it is functional versus disabling, and that's such a
Yeah.
point.
Yeah.
Absolutely.
I wonder if that was a CBT therapist too.
I believe it was.
CBT idea.
Carly, you can take credit for that. I won't name names, but another question. This is really interesting, and I think a lot of people are struggling with this right now, although it doesn't feel like a struggle, perhaps, as you will see from the question. What are some ways to manage guilt during times like these? For example, when having good days or exciting news, despite all that is going on, and feeling like you shouldn't be happy when there's so much suffering, or feeling as though you should keep it to yourself so as not to make others feel less than.
Well, I'm noticing the word should in there, and you're already
You're a great detective.
You're already setting yourself up to feel disappointed in whatever you do, right? Like it's that all or nothing. If I don't do this, then I'm a failure, or I shouldn't feel this way. You're human, and you have to lean into the goodness of what's going on too. And that doesn't mean you discount someone else's experience or that your situation is different than the other. And I think it's just practicing the holding two different things at the same time. Like things are really crappy right now, and I had an okay day today. And you can hold on to both of them.
Yeah. And also don't underestimate the extent to which your own happy day might actually lift someone else up. I think we make this assumption that if I tell someone that I had a good experience, it's just going to knock them down. If they're someone that really supports you, that might actually make them feel more optimistic. Yeah,
I agree.
If there are any other, I'm going to go back to the Q&A. Was there something else? No. Well, if there are no other questions, I wanted to thank everyone for joining us today. I wanted to really, really thank Carly and Rivka for sharing with us your expertise. This has been really fun for me, and hopefully fun for you guys as well. And we don't want this 1 hour to be it. We really would love to hear from all of you. We'd love to hear any questions that you might have. So I'm actually going to just share with you, here, technology, not my,
You have
there it. We got it. You see it now?
Yeah.
Great. So if you have any additional questions, please feel free to contact us. Here's our email, our phone number, our website. If you want to take a screenshot, I don't know how to do it on a PC. I know on a Mac, you do Command-Shift-3, and then you just have a screenshot of this. Or if you want to just take out your cameras, take a picture of this. We really would love to hear from you, whether you have questions about anything we discussed today or about the services that we provide at Grand Central Psychology. Please feel free to reach out to us. And thank you so much for participating and for making this an interesting afternoon. And we wish you guys all a good weekend, health, both physical health and mental health, and take care.
Thank you, everyone.
Thank you.